My name's John Moore. I'm a practice nurse at the Charlotte Keel Health Centre in Easton in Bristol. A lovely thing about working in the general practice environment is that you have the opportunity to build relationships with patients who come to see you, and that might be over years. For instance, I've seen children come in for their asthma reviews, and then some years later I've seen them bring their own children in. So that's really makes for quite a lovely, rewarding part of my job. Because I see people for various different long-term conditions, some people will have just one long-term condition that we're reviewing that day. Quite often people will have more than one. The work with that individual person is to come with them to a place where they're feeling more able to take control of their condition. So my practice is quite a large practice. We've got over 17,000 patients. Our nurse team, there's about 15 of us in the nurse team, and we have a similar number of GPs working in the team as well. And we have healthcare assistants who support us. And then from time to time, we're fairly regularly through the year, we have student nurses with us as well. In terms of training, my journey at the practice has been from not being too familiar with GP land and working in a GP practice. I've been put through various training courses, and that's been built into degree modules, so I was able to upgrade my old guard registered general nurse qualification to a degree qualification, and the practice has been supportive of that over the years. That's helped me to develop. The team at the Charlotte Keel is a supportive team and has a similar goal, and I think if your goal is that you want to see what's best for the patients who are seeing you, you want to see good outcomes for them, then the team is going to go with you on that. If there are things that are beyond your competence level, then it's fine to go and ask other members of the team and get support with that. Often people are quite stuck when you see them and you're talking about their long-term health condition. To be able to go with that person and be part of bringing them to a point where they feel able to take control of their own condition and manage it more effectively themselves, I find that a really rewarding and motivating part of my work. I think on the whole, the patients value the service that they're getting from their GP practice, from their practice nurse, from the whole team. So I initially came into general practice because of having small children, and I spotted that there was some opportunity for flexibility around that, so I've been able to work part-time. So that was my initial, a strong motivator initially. However, I've found that it's a job that I really enjoy doing and find very rewarding. I moved to Bristol from London into the job that I now work in about 17 years ago. Couldn't really afford to live in London, and were looking for a nice place to live to bring up our kids. My commute to work is a 20-minute cycle ride along off-road cycle path. Compared to London, that's just a nice way to get to work. One of our GPs came to me and suggested that I take on a role with the local CCG, the Clinical Commissioning Group. And that's been really a nice way for the practice to support me to develop and enhance my role. So I'm still doing my practice nursing role, but I've also now got a role in strategic development of diabetes care across Bristol, North Somerset and South Gloss. I'm really grateful to my practice for supporting me in that way.